Good week, everyone. I'm Karen Sullivan. I'm the health officer for Butte-Silver.
And I'm Serena Brewer, the interim medical director for the Community Health Center.
And welcome to our weekly COVID-19 message, co-sponsored by the Butte-Silver Health Department and Southwest Montana Community Health Center. Serena and I were just speaking a moment ago, and we're so gratified about our collaboration and partnership in taking care of this great community of Butte-Silver. And I'm so proud to be working with our Community Health Center on everything we're trying to accomplish. This week, we wanted to talk about identifying close contacts in the context of COVID-19. I think it's important to remember that not everyone will be named a close contact as we begin our contact tracing when we have a positive case of COVID-19. But for COVID-19, a close contact is anyone who was within 6 feet of an infected person for at least 15 minutes. An infected person can spread COVID-19 really starting 48 hours or 2 days before the person had any symptoms or tested positive for COVID-19. That indeed is the tricky part of this virus. So let's talk about a close contact and how that can be defined. A close contact can also be defined as someone who took care of someone at home who is sick with COVID-19, someone who had direct physical contact with the person, like touching, hugging, or kissing, someone who shared eating or drinking utensils, someone who sneezed, coughed, or somehow got respiratory droplets on you, someone who drove in a vehicle with you. And also think through, does someone share a workspace with you? Or do you share common work areas at your work environment? Those are all things to consider when you have been identified as a close contact. I might add that a lot of people think they are a close contact to a COVID-19 positive case, but unless you've been notified by the health department and formally identified as a close contact, you are not one. And so we tell people, if you can, to keep calm and carry on.
Karen, what if I was wearing a cloth mask and I was still identified as a close contact? Am I still one?
Serena, you are. You are a close contact, even if that mask wearing was established, but all those other factors were in place. So I do want to underscore, though, that every case that we investigate is different from another. So every case is individualistic, but generally, yes, wearing a mask does not eliminate you from being a close contact.
I have one more question.
Okay.
If I'm identified as a close contact and I test and I'm negative, do I still really have to quarantine?
Unfortunately, you do. The insidious thing about this virus is you can test negative on one day, but be positive later on. And so everyone we talk to, really, if they're a close contact, they need to serve a 14-day quarantine, 14 days from the time they have contact with the positive individual. So even though you get a negative test outcome, you have to serve your 14 days. And you can call the health department, our call center, 497-5008, and we'll talk you through it.
Okay. One other issue we wanted to let you know about was a change in testing opportunities through the Community Health Center. We are still going to be testing close contacts and healthcare workers 3 days a week, Mondays, Wednesdays, and Thursdays from 11 to 1. However, now for symptomatic individuals, we are giving you the option of whether you would like to have a visit and be tested or whether you would like to do drive-up testing. We still ask for anyone who is symptomatic that you call ahead to arrange this type of testing with the clinic, but again, you have the option of now being seen in a visit or being seen in your car to be tested. That will begin on Monday, August 24th.
We want to thank you for listening to our weekly message, sponsored by the Butte-Silver Health Department and Southwest Montana Community Health Center. With questions on what it means to be a close contact to a COVID-19 positive case or testing, please call our call center at 497-5008. Thank you and have a good week.